السلام عليكم ورحمة الله وبركاته. Large intestine. Anatomy of the large intestine. What are the parts of the large intestine? We have the large intestine about 1.5 meters in length, starting from the right side at the cecum. Starting at the right side at the cecum. This is the cecum, and this is the ascending colon, and this is a transverse colon, descending colon, sigmoid colon, and finally rectum and anal canal. These are the parts of the large intestine. 1.5 meters. طيب. What are the difference in between small and the large intestine? The small intestine here in the middle, and it is like a simple tube, about 6 meters in length. But the large intestine is in the periphery and about 1.5 meters in length. This is the first difference. The second one, the large intestine characterized by the presence of what is called tinea coli, this muscle. This muscle in the wall, it is like a longitudinal muscle. This is a muscle. This line is a muscle, longitudinal muscle, موجود present in the wall of the large intestine and absent in the small intestine. About three band of muscle in the wall of the colon. This is what is the name of this muscle? Tinea coli. How many band of this line? Three band. Very important, this tinea coli absent in the appendix and the rectum. يعني in this band أو the tinea coli which is more characteristic feature in the large intestine, absent in the appendix and absent in the rectum. طيب. Due to this muscle make the wall of the colon like sac يعني أكياس متكيس. This sac named sacculation, very characteristic for the large and absent in the small. What else? The wall of the large intestine characterized by the presence of the yellow peritoneal sac, like that. This peritoneal sac, yellow color, peritoneal sac in the wall of the colon. What is the name? Appendices epiploica. Appendices epiploica. Absent also in the small. يبقى we have three main features in the large and absent in the small. Number one, this band of muscle named tinea coli. Number two, this sac or sacculation, and finally appendices epiploica. طيب, first of all, we have to know about some important point about every part of the large intestine. You have to know that we have foregut, midgut, and the hindgut. The foregut starting from the upper part of the esophagus, stomach, upper half of the duodenum, liver, and pancreas. The midgut from the lower part of the duodenum, jejunum, ileum, cecum, till right to third of transverse colon. يعني all this part of the large intestine is midgut. يعني what is the arterial supply of this part? سما, superior mesenteric artery. يعني what is the arterial supply of the cecum? سما. Ascending colon? سما. Right to third of transverse colon? سما. So all these parts are supplied by what is called سما, superior mesenteric artery. يبقى يعني you have to know that every part of the large intestine you have two important features. Number one, what is the arterial supply of the cecum? ها? Cecum, midgut or foregut or hindgut, midgut. So the artery will be sema or ileocolic of sema. Ileocolic, it is a branch of superior mesenteric. And most of the GIT, also the vein, superior mesenteric vein, and the final destination of the GIT will be portal vein. طيب, what is the peritoneal covering of cecum? The cecum completely covered by peritoneum, but the peritoneal fold covering no name, complete covered. يبقى if I ask you about what is are the peritoneal covering of the cecum will be complete covered. Cecum have many opening. The cecum هنا the opening for the ileum at the ileocecal valve, and below it you will find the appendix 1 inch below this ileum, and no ileocecal have a valve, but the appendix no valve, and but 1 inch below the ileum, and also continue above as ascending colon. Appendix about 6 centimeter up to 10 centimeter in length, and opening in the cecum below the opening of the ileum. This is the position of the ileum. This is the position of the cecum. If you open, you will find that the cecum, the appendix, not in a definite position, have many positions. The most common position of the appendix is behind the cecum, retrocecal. You have to remove the cecum to find the appendix behind it. And also some يبقى the most common about 70% of the people عندهم الابندكس behind the cecum. But we have many other different position like pelvic position and subcecal below the cecum, or in front of the ileum or behind the ileum, pre-ileal and post-ileal, and the least common is post-ileal. يبقى the most common position of the appendix is retrocecal, and the least common is post-ileal. What is the peritoneal covering of appendix? Appendix complete covered by appendix, by peritoneum, and the name of the peritoneal covering of appendix named mesoappendix. يعني this yellow color is the mesoappendix, the peritoneal covering of it, and also contain artery. The mesoappendix here contain the appendix and the artery supply of the appendix. What is the name of this artery? Appendicular artery. This artery branch from SAMA or ileocolic of SAMA اللي هو superior mesenteric، لأن الابندكس considered as midgut, and also drain in the superior mesenteric vein to the portal vein. Most of the midgut, superior mesenteric vein and the portal vein. What is the surface anatomy of the appendix? If you take a point at the umbilicus and a point at the Aziz, anterior superior iliac spine, and divide this line into medial 2/3 and lateral 1/3. This point named McBurney point. McBurney point. McBurney point, any patient came with appendicitis may pointing to this point as a pain on this area. And also if you open to remove the appendix, you have to McBurney point or to open. يبقى McBurney point, it is a line or a point between medial 2/3 and the lateral 1/3 of the line between the umbilicus and Aziz, anterior superior iliac spine. ascending colon and descending colon. Ascending colon البروتونيال covering front and the sides only, not completely covered as the transverse or cecum. And also the arterial supply of ascending colon will be right colic. It is true. Branch from where? Right colic artery from SAMA, from superior mesenteric artery، لأن الاسcending colon يعتبر considered as midgut. Regarding to the blood supply خلاص سما ileocolic ileocecal right colic all, and this drain in the portal vein, superior mesenteric vein and the portal. Mostly of the midgut, the drainage, the venous drainage is superior mesenteric vein and finally to the portal vein. طيب what about the transverse colon? Transverse colon here لها two part. Right 2/3 from the midgut and the left 1/3 from the hindgut, so have double blood supply. Very important. have double blood supply. The transverse colon mid gut and the hind gut. So have double blood supply. Sema and Ema. Ema means inferior mesenteric, which is a supply of the mid of the hind gut, and the Sema supply the huh, hind Sema mid gut and Ema hind gut. So they have double blood supply. And also the portal vein, part superior mesenteric vein and inferior mesenteric vein, to finally both to the portal vein. What is the peritoneal covering of the transverse colon? Completely covered. And this yellow color named transverse mesocolon. يبقى transverse colon complete covered. And the name of the peritoneal covering is transverse mesocolon and have double supply سمة and إيمة. What about the transverse mesocolon? Transverse mesocolon like a cover or a peritoneal fold of transverse colon. You have to mention number one the definition. يبقى transverse mesocolon means هو عبارة عن peritoneal fold of transverse colon. طيب attachment between what and what? It is encircle or cover the transverse colon and attached to the pancreas. This is the anterior border of the body of the pancreas. This transverse mesocolon will attach and cover the transverse colon and then return back like that. So, the transverse mesocolon have attachment number one to the anterior border of the pancreas and enclose the transverse colon in the free border. طب what is the content of the this covering? يبقى you have to mention what means by transverse mesocolon, peritoneal fold of transverse colon, and attachment between what and what. يبقى attached to the anterior border of the pancreas and includes the organ itself اللي هو transverse colon. طب what are the content? Usually the content fat, nerve, lymph, and so on. This is usual of the all content of the all peritoneum of the abdomen, but you have to specify according to the peritoneal fold. يعني what is the name of this هنا? Transverse mesocolon. So it contains the organ itself اللي هو transverse colon. And the blood supply of the organ اللي هو middle colic artery from سما from superior mesenteric. This is the content of transverse mesocolon. So we have during the embryological origin of the GIT, we have foregut and the artery supply celiac from the front of aorta at the level of the upper border of L1 and the midgut till the right two-third of transverse colon supplied by superior mesenteric from the lower border of L1 and finally hind the gut from the left one-third of transverse colon descending sigmoid and the rectum and the upper part of the inner canal supplied by EMA artery inferior mesenteric from the L3 يبقى L1 L1 and L3 upper border of L1 and lower border of L1. What are the organs supplied originating from foregut and midgut? Duodenum. So the artery of the duodenum will be both celiac and sema, superior mesenteric. طيب what is the organ originating from the midgut and the hindgut? Transverse colon. So the transverse colon supplied by sema, superior mesenteric artery, and plus ema, inferior mesenteric artery. Descending colon also the same of ascending colon covered from front and the sides, but the descending colon it is one of the part of the hind gut, so the arterial supply will be ema artery, inferior mesenteric, inferior mesenteric, inferior mesenteric artery from the left colic, and the vein inferior mesenteric vein, and finally to the portal. Sigmoid colon. What is the beginning and the termination of sigmoid colon? Hmm. What is the beginning and the termination of sigmoid colon? Sigmoid colon here starting at the left pelvic brim. Left pelvic brim. as a continuation of descending colon and continue or terminate to become a rectum at sacral vertebra number 3. Very important. يبقى starting at the left pelvic brim, continuation of the descending. This is the beginning of the sigmoid colon. What means by sigmoid? يعني S shape, and continue till the level of S3, sacral vertebra number 3, to become or to continue as rectum. Covered or not covered by peritoneum? لا, sigmoid colon completely covered by peritoneum. And what is the name of the peritoneal covering? Sigmoid mesocolon. طب what is the arterial supply of a sigmoid colon? Mid gut or foregut or hind gut? This pelvic colon or sigmoid colon, it is hind gut, so the arterial will be ema, inferior mesenteric, and the vein will be inferior mesenteric vein to the portal. What means by sigmoid mesocolon? Sigmoid mesocolon definition, it is a peritoneal fold of sigmoid colon. طب what are the content? What structure inside the organ itself? What is the organ? Sigmoid colon. طب what is the arterial supply of sigmoid colon? Sigmoid vessel and also superior rectal vessel. All are the content of the sigmoid mesocolon. Sigmoid mesocolon, like here, this is a sigmoid colon and this is a sigmoid mesocolon, the peritoneal covering of the sigmoid colon. So any peritoneum contain the organ which enclose it and also the blood supply of this organ. EMA. What? EMA artery. EMA artery, as we said, it is the artery of the hind gut. طيب, which part will be supplied? Supply the left one third of transverse colon, the descending colon, the sigmoid colon, and the rectum, and the upper part of the anal canal. طب which originated from where? EMA originating from the front of aorta. All the arteries supply the abdomen, the three main arteries from the front of aorta, but here at the level of L3, EMA. And what is the termination? هو descending like that, descending and continue to become superior rectal, supply the rectum and the anal canal. So what is the terminal artery of the EMA? Superior will be superior rectal. طب what are the other branches of the EMA? Will give artery to the transverse and the descending colon. This artery named left colic. As we said before, we have right colic and middle colic from SEMA, but the left colic from EMA supply what? Transverse colon, the remaining part, and the descending colon. And also will give about 3 or 4 branches to supply the sigmoid. So it is named the sigmoid arteries. So inferior mesenteric artery or EMA give only 3 branches. Left colic, which supply the remaining of the transverse and the descending, sigmoid vessel, which supplies the sigmoid colon, and rectal, superior rectal artery, which is the terminal part of the EMA. Oh, these are the branches of EMA. EMA يبقى left colic, sigmoid, and rectal. Only 3 arteries: left colic, and the sigmoid, and rectal. طيب, what are the artery from here, from the to ascending colon? Right colic. طب to transverse colon? Middle colic. طب to the cecum and appendix? Ileocolic. So all these are named colic, which are branches from SEMA and EMA. And all these artery must anastomose to each other. يعني all these artery anastomose with each other to form a marginal artery to supply whole every part of the colon. Regarding again foregut, midgut, hindgut, so the artery of the foregut هو celiac, so the lymph node will be celiac, so the nerves sympathetic will be celiac, and the midgut, the artery سما, so the lymph node will be superior mesenteric, والsympathetic will be superior mesenteric. The hindgut EMA, so the lymph node will be EMA lymph node and the EMA plexus of sympathetic. Type. What are about the parasympathetic? The foregut and the midgut supplied by vagus nerve. Vagus nerve supply all the GIT till left colic flexure. يعني transverse, descending, small intestine, stomach, esophagus, all are the large intestine or the GIT supplied by vagus parasympathetic لغاية left colic flexure. But below left colic flexure يعني descending colon, sigmoid colon, rectum and anal supplied by pelvic splanchnic nerve or sacral 2, 3 and 4. This is a parasympathetic supply of the remaining part of the GIT. We have what is called sensory nerve supplying some specific part of the GIT, and this part radiating have a radiating pain like مثلا gallbladder and the liver and the gallbladder supplied from right phrenic nerve. Right phrenic nerve و right phrenic nerve ده الاورجن بتاعه. What is the origin of the right phrenic? C3 and 4 and 5 like also the gallbladder, and so any inflammation of the gallbladder radiating into the right shoulder and to right neck. Why? لأن النيرف سبلاي بتاعها right phrenic nerve and the supply هنا what is the origin of the right phrenic? Cervical nerve number 3 and 4 and 5. Also, any patient have appendicitis starting to complain from the pain around the umbilicus. And then this pain will shifting to the right iliac fossa. يعني starting the pain here at the umbilicus, بعد كده البين ده go to the right iliac fossa here. Why this pain starting at the umbilicus? Because the umbilicus and the appendix have the same nerve supply. What is the same nerve supply? T10, thoracic nerve, spinal nerve number 10. Finally, we have to know about lesser omentum. We knew about before that the stomach complete covered by peritoneum. And what is the name of the peritoneal covering of the stomach? Omentum. If the peritoneum attached to the greater curvature, so it is named the greater omentum. If attached to the lesser curvature here till the upper part of the duodenum, so it is named from the lesser curvature and the upper part of the duodenum, it is named lesser omentum. So what are the attachment of the lesser omentum? يبقى attached to the lesser curvature of the stomach and the upper edge of the duodenum. طيب to where connecting the stomach to what? To the liver, to the البورتا hepatis and the fissure of the ligamentum venosum of the liver. يبقى attached to the lips of the liver. الهايلم of the liver اللي هو البورتا hepatis. طيب what are the content of this peritoneal fold? What are the content of this peritoneal fold ولا lesser omentum؟ هنا الليسر curvature contain two vessels اللي هو left gastric and the right gastric. So one of the most important content of the lesser omentum at the lesser curvature اللي هي left gastric and the right gastric vessel. Plus fat, lymph node, and fat and nerve and so on. طيب this part from the duodenum to the liver بنسميها free part أو الفري border of the lesser omentum. Free border of the lesser omentum. او بيسموها الرايت بوردر او الرايت فري بوردر اوف ذا lesser omentum. Contain what? Contain three important items or structures. A vein which is posterior here, portal vein, and in front of the portal vein you will find two يبقى portal vein, and in front of the portal vein you will find two important items: hepatic artery and common bile duct. Common bile duct here and hepatic artery and portal vein. Portal vein is behind and in front of it, one to the right and one to the left, common bile duct to the right and hepatic artery to the left. So all are the content of the free border of the lesser omentum. Our patient came to your clinic, gallstone, cholecystitis, removal, your finger here in the epiploic foramen, palpate the free border of the lesser omentum. What are the structure in the free border of the lesser omentum? As we said before, portal vein and in front of the portal vein to the right common bile duct, and to the left is hepatic artery. بقول لك ايه which structure is immediately behind. اه behind what? Behind the epiblock foramen. يعني الابيبلوك foramen in front of the epiblock foramen will be the free border of the lesser omentum, and behind it will be the biggest vein. ها behind is IVC. يبقى IVC behind, and in front of it epiblock foramen, and in front of the foramen will be free border and its content. Thank you so much.